Welcome, everybody. This is a wonderful collaboration from Maternal Infant Health Canada, and Healthy Seminars has been so lovely to host us, as they have for many other talks that we've done. For people who want to see some of the previous things that Maternal Infant Health Canada has done, if you go to the our website, which we will put in the chat box, you can see we have archived most of our other talks. We get speakers from around the world. It's all about innovative ways to support maternal and infant health and lower maternal infant death.
Thank you, Emily. And this is a real pleasure for me. I'm the founder of Healthy Seminars. I'm also the colleague with Emily Solomons. We both practice out of AcuBalance in Vancouver, BC. So this is a real treat. On our group today, as Emily said, we got the MIHCAN group, but we also have a large group from Healthy Seminars, acupuncturists as well. So I just wanted to remind everybody on the resource page on healthyseminars.com, if you go to our resource page, you'll see many of the free resources we offer. So I just wanted to bring that to your attention. We will put the replay up. There'll be probably a couple spots, so you can contact MIHCAN and Emily Solomons for that as well. And for those from Healthy Seminars, we're going to put it up on the MIHCAN page, and it will link from that resource page that I mentioned earlier, and you'll be able to find the replay. And it'll just be down below here near Emily's bio. I do want to remind you, just from Healthy Seminars perspective, and Emily's and MIHCAN here, that our disclaimer here is that this is for educational purposes only. This is not intended to be medical advice, and it shouldn't be interpreted as such. Again, this is for educational purposes only. If you do have a health condition, please seek out a qualified healthcare provider. All right, I'm going to pass this over to the MIHCAN group. And again, just wanted to welcome everybody from the Healthy Seminars family here. And Eva, it's all yours.
Awesome. Thank you, Lauren. And good morning, everyone. Thank you for joining us, or good afternoon or good evening, wherever you're calling me from. So today we have our very own Dr. Emily Solomons, who's an active founding member of MIHCAN, presenting on acupressure for childbirth and pregnancy. And before we begin, I'd just like to thank the founder and lead of MIHCAN, Dr. Farah Shroff, for organizing these super awesome and informative sessions. And I'd also implore you to check out our website and our Facebook page, which I will send along in the chat. So the way that the session is going to be organized today, I will give you a brief introduction of Dr. Solomons, and then she'll present for about 45 minutes, and then we'll turn it over to a Q&A. So please feel free to submit your questions in the chat box as we go along, and I'll do my best to capture them and feed them back to Emily at the end of the session. So without further ado, I have the pleasure of introducing Dr. Solomons. Dr. Solomons is a doctor of traditional Chinese medicine, and she's been practicing in reproductive health for 15 years. She's the president of the Obstetrical Acupuncture Association, as well as a fellow of the American Board of Oriental Reproductive Medicine. She's also co-developed the first obstetrical acupuncture training program for midwives in Canada, and in 2015, Emily became a cluster lead for Maternal Infant Health Canada. In keeping with her commitment to work at the community level, Emily has volunteered locally as a practitioner with St. Paul's Hospital and Friends for Life, and as an acupuncture detoxification specialist in Vancouver, Richmond, and New York. She's also taught nurses, midwives, and traditional African medicine practitioners internationally in Uganda, Nepal, and Mexico. So we're so looking forward to your presentation this morning, Emily, and I will hand it over to you.
Thank you so much, Ava. And yes, thank you, Farah, for being our wonderful, fearless leader. So just as everybody, as was mentioned previously, this is, actually, can we flip to the disclaimer slide so that we have this? So this is for educational purposes only. If you have a medical condition, please seek out a medical provider for that. All right, so yes, a few people will join in, but I think we should just start straight away. So Lorianne, if you want to give me control over my slides. That would be wonderful.
You should just be able to click your screen.
Oh, now it is working. There we go. Okay, wonderful. All right, well, let's get started. So as we said, what I'm going to be talking about today, and this is a lot it's going to be a mix of the people who are watching. Some are acupuncturists, but some are midwives, some are researchers who are around the world. So I really wanted to do something for people who work with birth and who are having clients, having patients in the community where people are getting pregnant and having babies. And so we want to be able to teach the partners, we want to be able to teach doulas, we want to be able to teach our community to better support pregnancy and childbirth. And so this is going to be more geared as a way for you to learn how to teach the community. So this is acupuncture for pregnancy and childbirth, an exploration of the evidence-based uses of acupressure, as well as a demonstration of how to perform and teach acupressure for pre-birth and labor. All right. As we all know, the experience of childbirth can be intense. The experience of pain can be amplified by emotional, physical, and psychological factors. There is growing evidence utilizing non-invasive, non-pharmacological methods of pain management, and among them are acupressure and massage. When I say acupressure, this is based off the meridian systems in Chinese medicine. While acupuncture is the stimulation of acupoints with needles, acupressure is the stimulation of specific acupoints using the body, so using your hands, your thumbs, elbows, or other tools just to provide pressure. When I'm referencing massage today, I'm specifically referencing moderate pressure massage. Pain management in labor through non-pharmacological means offers many benefits to both the patient and the medical facility. And what I'm going to do is just list a few of the benefits. So number one, it is a non-pharmacological form of support. Number two, acupressure and massage offer tools that are simple, safe, and can be taught to, as I've mentioned, partners, doulas, birth support workers with relative ease. No equipment is necessary, and this form of support can be administered early and throughout the childbirth. And that's because it doesn't lead to a cascade of intervention. So we can start this very early on, and it fits in line with the Chinese medicine approach, which is a preventative style. Number four, it is cost effective. And this is extremely important as well. Five, preliminary reviews show incorporating the teaching and use of acupressure and massage is, most importantly, very, very safe. And I think I can't emphasize this enough about the safety of this tool. Number six, it promotes positive emotional and physical connections during childbirth. And finally, it can be used to promote partner involvement and engagement. And times are changing, and we're getting a lot more desire from partners to be part of the birth process. And this is a wonderful way to include them in that. So we're very fortunate these days to have much more interest with the partners. And so to be able to teach them, I found that they need often a really pragmatic tool of something they can do because they're not used to going to births. And so for them to have something that they can reference and they can go to, it's very helpful. Okay, so there are several options for teaching acupressure and massage. I like to do it during a prenatal visit with the partner or family present. There's also prenatal group classes or training of doulas or allied healthcare workers to pass on the knowledge in their own personal visits with their clients. So this here is a photograph of a training that I did for a group of midwives who worked with the indigenous community in Chiapas, Mexico. Some of them are actually online right now. And here is a midwife who is teaching the husband how to perform acupressure during a routine 38-week visit. So you can see that she just tagged it along at the end, and she's showing him directly how to do this. These photos here are also in Mexico, and here we did a free acupressure training that was offered to the community where doulas, midwives, and interested community members attended. And so what I like about this form of training in non-COVID times, I have to mention, that it also builds community, and it can be coupled with other prenatal and postpartum best practice education, so as well as local cultural traditions. So you have this tool of acupressure that you're teaching everybody, but you can add it so easily to whatever your normal prenatal class would include, whatever cultural traditions locally are used. It doesn't have to be a standalone. Okay. There are more and more studies being done on acupressure for labor and childbirth, and I'm going to highlight just a couple of them today. We could have an entire course just on the research, but I think that maybe that's another day. So in this systematic review, data was reported on 748 women using different acupressure points and methods of administration. One study examined the initiation of labor, while the other 6 studies examined labor duration and or pain levels. The 2 most studied acupoints were spleen 6 and large intestine 4, which you will learn today. And so the results suggested that acupressure may reduce the length of labor, and particularly in the first stage. So what I'm going to do here, as with all the studies that I reference, is I'm just going to pop this in the chat room here. And I'll do this with everything so that if anybody's interested in looking more into the research, you can just go to the chat box and then grab the website so that you can actually go check it out at another time. There we go. All right, so another study that was done in Australia was called the Complementary Therapies for Labor and Birth Study, a randomized controlled trial of antenatal integrative medicine for pain management in labor. And this was a colleague who is part of the Obstetrical Acupuncture Association, and I really love the potential of this study. So this took a population of 176 nulliparous women with low-risk pregnancies attending hospital-based antenatal clinics in Sydney, Australia. This study provided a 2-day antenatal workshop that incorporated 6 evidence-based complementary medicine techniques. There was acupressure, visualization and relaxation, breathing, massage, yoga techniques, and facilitated partner support. So you can see how easy it is to combine acupressure with other forms of support. So randomization occurred at 24 to 36 weeks gestation. One group of participants attended the 2-day antenatal education program plus standard care, and the other group received standard care alone. The main outcomes measured were rate of analgesic epidural use, and the secondary ones were onset of labor, augmentation, mode of birth, and newborn outcomes. So again, what I'm going to do is just pop this one in there as well. So the findings with this study were that epidurals were reduced by 65%. Cesarean sections were reduced by 44%. This study provides evidence for integrative medicine as an effective adjunct to antenatal education and contributes to the best practice evidence. The study was small, but this is a study I would love to see reproduced for different demographics. I've included in your handouts, so we're going to be having handouts that we give you. Excuse me. We're going to have handouts. I'm going to make sure that you get both the study posters, but I'm also going to be giving you handouts for the acupressure and the massage as well. So as part of the handouts, I'm going to give you the study posters, the economic analysis, and the supplementary handout, which outlines the details of each technique used. What I especially liked about this study is its inclusion of an economic evaluation. So this was the thing that really just blew my mind. So the highlights for this economic evaluation were that there was a cost savings of 650 Australian dollars per patient. So the savings were obtained mainly through reduced medical interventions. Other highlights are that complementary therapies antenatal education course also supports normal birth. Lowering rates of intervention saves money for government and hospitals. And economic analysis should be embedded in all perinatal trials. So I really could not agree more with this last point. As much as I believe the physical and emotional benefit to a person birthing should never be given a financial value, showing economic savings to a hospital, clinic, or government can help initiate conversations and stimulate interest in implementation. So yes, the study is there, and the poster you can also see there. You can actually download it right from our chat room. So let's move on to massage. There is good evidence for moderate pressure massage for its effectiveness in reducing pain and improving maternal outcomes during labor. The moderate pressure stimulates vagal afferent fibers under the skin, which stimulates the release of GABA and oxytocin through the vagal nerve connection. It also bonds couples by promoting oxytocin and beta endorphins, which are essential in labor. Now, being respectful of the time we have for this lecture, I'm simply going to share some of the links in the chat box so that people can review. So I've put in a Cochrane review and then a few other studies. So everybody's going to have so much homework at the end of this. Well, you'll just have things. For anyone who's interested, that is everything on the slide there for you. So it's just easy to cut and paste. Uh-oh. I may have accidentally clicked on a link. We might go directly to something here. I'll have... Always happens when we have a live webinar. I have to press something funny.
It'll just be a second so I can take down that link.
So yes, essentially, oh, here we go. So yeah, I just clicked on the link. We don't need to go there straight away. For everyone who's interested, you can go there after. There we go. All right. So without further ado, we're going to start talking about, I'm going to start explaining the massage. I'm going to start with the massage and then I'm going to go to the acupressure points. However, with the massage that I'm going to be showing you today, it actually incorporates a lot of the acupressure points as well. So you'll see reference to like GB21, gallbladder 21. That's actually a location of an acupressure point that you'll be learning later in this webinar. And don't worry, you will be getting handouts with the image and description of each point and massage technique. So this first point is gallbladder 21 massage in the upper shoulders. So starting from the top of the neck, massage down the towards the shoulder, releasing any tight areas as you pass through that gallbladder 21 point. So realistically, you're just taking from the top of the neck and they're going down along the traps towards the shoulders. This point is a favorite of, I feel like, everybody in the world because we all carry so much pressure up here. And with pregnancy, breasts are getting larger, they're getting heavier, and we tend to hold a lot of tension up in this area. So this is usually a favorite point of patients. I will say though, as much as everybody loves this point, this should only be done after 37 weeks. And you'll see this in the handouts, and I'll reference this later. It has a descending action that is good for high presentation. So when babies are kind of sitting up a little too high, too long, but it shouldn't be done earlier in pregnancy because of that descending action. It's also a wonderful point to massage in the postpartum period, especially for those breastfeeding, since in the early days of breastfeeding, it often involves like an awkward, especially first-time parents. When you're learning how to breastfeed, your shoulders often end up, by the time you have the baby latched, your shoulders end up like this. And so to really be able to massage this area, that can help relax the area, which can actually help with letdown. The next point is at the base of the spine. So starting at the top of the sacrum, you massage downwards, out and over the buttocks to release any tight areas. I find people grip their buttocks and hips in the last stage of pregnancy as they compensate for their belly. So their belly is getting bigger, and then they tuck in their hips to be able to hold the weight of the belly. And what happens then is you get a lot of tension around the buttocks. So being able to massage outwards here can actually help the pregnant person relax their hips and pelvis, which is really important as the baby's getting engaged. This is also a really great area for readying the cervix very gently, as well as opening and loosening the hips to allow baby to engage easily. This point should also only be done after 37 weeks. And you're going to hear me repeat this a million times today. And that's just because this is a really important piece. A lot of people, partners and doulas, they think, well, if this is good now, maybe I'll start a little bit earlier. But we really need to emphasize when we're teaching when to start. And so, yes, I would definitely reference after 37 weeks. This also feels really good in a lot of stages of labor, especially when back pain is happening. So sometimes with malposition, we have something called back labor, and this massage can be really helpful in that case. For the next point, so this is on the inside of the leg. So what you do is you start at the shin bone, the tibia, on the inside of the leg, and you massage in small circles with your thumb up the inside of the tibia, just in the posterior part, until you reach the bulge of the calf muscle. So you can see those little blue arrows, and what you're doing is you're just doing circles. So you're not on the bone, you're just behind it, and you're doing small circles. This one I do find you don't want to do too firmly because it is quite a tender point. It doesn't feel as good as the one on the lower back or the one on the shoulders, but it is a really good point and can help with readying and preparing the cervix. As I mentioned, I bet you people can guess when this should be started, and it is no sooner than 37 weeks. The next point for massage is between the first and second metatarsal bones. So holding just posterior to the ball of the foot, so underneath the foot, you can place your index finger on the top of the foot and massage the space between the big and the big toe and the second toe until you reach the bone. This is a fantastic area to massage for stress, and luckily for this point, you can actually do it anytime during the pregnancy. And finally, we have, this is on the base of the foot, and you see a little circle right there underneath the ball of the foot. So using either your thumb, or what I do is I get people to find a round, smooth rock, and they can use that as well if they want to do self-massage. But if not, you have someone come and they use their thumb and massage gently just under the ball of the foot. This point is really calming and grounding and can be used anytime someone is anxious and even during transition. This point can be done anytime in pregnancy, childbirth, or even postpartum. And massage can generally be provided like any kind of massage can be done in any stage of childbirth as long as it's wanted by the person, obviously. It seems funny, but we want to be asking for consent so that at each stage, because things change throughout, and at some stage someone would want it, but at other stage they may not. So being in tune with really what the person who's in the childbirth process wants, that we're actually listening to their needs. Okay, so though the above points are helpful, any moderate pressure massage that feels good can stimulate the release of GABA and oxytocin and can be helpful. So I often suggest that couples play around with the massage that just feels nice and relaxing before the labor begins. You can get a little bit of oil, any kind of safe for the body. People have used olive oil, really anything, and just moderate pressure up the back, down the legs, anywhere that feels tight, and a way to kind of communicate and really create further bonding between either the couple or any of the people who are going to be at the birth. All right, so that is the massage, which is a little bit more general, and now I'm going to get into acupressure. With the acupressure, I have a video where I'm going to do demonstrations as well, so you'll be able to get a bit of a better sense of really what the acupressure looks like. So you will have all received or will be receiving copies of the acupressure reference sheet with details on each point, its location, function, as well as the combinations to use for different situations. These are the sheets I give my patients, and I've actually left them editable. So they're not a PDF for you. I've purposely put them in Word so that you can translate them into whatever language or dialect you need. It is mostly images so that we're not relying on the literacy of the person who is in labor. However, there are some descriptions as well, so having both options I find the most helpful. With acupressure, I suggest people start before childbirth. It's ideal if acupressure could be started prior to the start of childbirth, usually around 37 or 38 weeks. This allows a pregnant person to give feedback on the comfort levels and for the person providing the acupressure to become familiar with the points. Once childbirth begins, the most benefit is gained when the acupressure is started early on. There's no risk in causing a cascade of intervention with this mode of support, so starting early is highly encouraged. Trying different points throughout each phase and stage of the childbirth process is suggested. So often laboring person will know and communicate which points feel good, which ones they want, and which ones they no longer want. I don't suggest interrupting a laboring person during a contraction or a birthing wave with questions like, oh, should I do this? Do you want this? They don't want to be coaching generally. So you want to just gently try. You can look at the reference sheet. You can see which ones look most appropriate, and you can try them, and you'll get very immediate feedback on whether that feels good or that it doesn't feel good. And then also following the cues of the person in what feels most useful at the time. Points should be comfortable. Though some feel better than others, the points shouldn't inflict pain or discomfort. That is counterproductive. So it is not a more pain, more gain. What you're doing is you're matching the intensity of the person who's in the childbirth. So when the person is in they're not in labor yet and you're just practicing, you're doing your pre-birth, you may do a very moderate pressure, but you might notice as the childbirth progresses, you're doing firmer and firmer pressure because sometimes, especially with the back ones, the laboring person might actually push up against it because they want more and more pressure. So what you're doing is you're just doing a feedback, but the person should find the points comfortable. That's the real take home. And finally, it's very important to allow the laboring person to remain in a position that is comfortable to them when performing the acupressure. So it's not about getting them into a position so you can access. You're getting right down on the ground. You're teaching the partners. They're getting down. They're getting in awkward positions to be able to reach the points so that the person who is birthing that baby, they are comfortable. They're in the place that feels the most comfortable, the position that feels the most comfortable. I've put a little image there on the slide so you can see all the wonderful different positions that that people are in when they're in labor, and you can do acupressure in any of those positions. So this is not a stirrups kind of situation happening here. So I have filmed a quick video here that's going to go through each point, and it's on someone so you can actually see a bit more clearly what that would look like. How to perform acupressure. The key with acupressure is that you're applying a firm pressure. This is not a massage, so you're not doing a circular motion, but just applying a firm and steady pressure. This should be comfortable for the person that you are doing the acupressure on, but not so light that they can't feel it. We want firm but comfortable pressure. You can use your thumbs for the acupressure, your elbows, or your knuckles. To locate gallbladder 21, have your pregnant person tilt their head downwards. You will find the most prominent point on their neck, which is C7. From that point, you draw an imaginary line to the end of the shoulder. The midpoint between those two on both sides is gallbladder 21. To apply pressure on this, you can use your thumbs or your forearms or your elbows, but be mindful of the amount of pressure, as the elbows can apply very firm pressure. The purpose of this point is to both relax tension, as tension tends to build up in the shoulders, but also causes a downward movement, so it can be helpful with letdown once the baby is born for breastfeeding, as well as in the second stage of pushing, or any time that you notice the person is holding a lot of tension and is unable to relax. Large intestine 4 can be located on the hand between the thumb and the index finger, in the meaty part between the two bones. The best way to perform this is to stick your hand underneath the person's hand, and then the thumb just between the thumb and first finger. Pressure is applied firmly, but again, comfortably. If you are doing both hands, I suggest that the person performing acupressure crosses their hands so that the person receiving the acupressure can remain in a comfortable position. Firm pressure is applied, and the purpose of this point is both an analgesic point for pain management during labor, as well as to help establish firm contractions. To locate bladder 32, you'll first need to look at the length of your pregnant person's index finger. We're looking from the length of the knuckle to the tip of the finger. So if your hand size is different than the person that you are performing the acupressure on, you want to measure against their hand. Our hands are the same, so I will use my length. To locate bladder 32, you take the length from the knuckle to the tip of the finger above the top of the crease of the buttocks. And then 1 finger width on either side of the midline. So here are the points. What we were aiming for is the second second sacral foramen. To apply pressure, you put your thumb on either side and press firmly in. When we are performing acupressure, we don't, especially in labor, we don't go in very quickly. What we do is we wait for the person to have a contraction, ease in with the contraction, hold for the remainder of the contraction. Then once it has passed, we ease off slowly. So ease in with the wave of the contraction and ease off as the wave subsides. You can also use your knuckles for this point, or a firm palm pressure acting as a counter pressure. To locate spleen 6, we take again the hand width of the person you are performing the acupressure on. So measure the hand to make sure that you have their width of their hand. Then the location of spleen 6 is 1 hand breadth above the medial malleolus, or the inside ankle bone. The point is 1 hand breadth above and just posterior to the bone. Acupressure can be performed with a thumb like this, or from behind with a thumb like this. This point is not as comfortable as other points and may feel a little bit bruised, but it is a very important point to help with establishing regular contractions and with ripening the cervix. To locate bladder 60, find the lateral malleolus, or the outside of the ankle bone. Find the tip and then the posterior portion of the Achilles tendon. The midway line between the two, in the nice divot inside there, is bladder 60. What you want to do with this point is press firmly like this and not pinch either side of the Achilles tendon. So the pressure is generally a firm pressure, and your thumb should fit nicely between the 2 points. This point is very important when helping adjust malposition or to establish contractions during an epidural. To locate bladder 67, first locate the small toe on the foot and find the most lateral side of the nail and at the base of the nail where the cross section happens. So we find the outside of the nail going down and then the base of the nail going across, and where those 2 points meet, we have the point. This is bladder 67. This can be, because it's a small point, this can be stimulated with an emptied pen, non-marking pencil, or anything small but dull on the end. Pressure is applied firmly, and it can be used for malposition when used with acupressure. When used with moxibustion, a heat therapy, this is the point used for breech presentation. To locate kidney 1, you first need to find the sole of the foot. If you divide the foot without the toes into thirds, the kidney 1 acupressure point is located in the top 2/3 of the foot. So if we take away the toes, divide into 3 parts, between the first and second part in the center of the foot is kidney 1. This point can be acupressured like this, or if the person is sitting down, you can acupressure from underneath as well. This point is very good as a calming point during transition or anytime the person who is laboring is feeling very anxious. This point can also be done anytime through pregnancy, as it is a safe point for acupressure anytime in pregnancy. To locate pericardium 6 or PC6, you need 2 fingers. Remember that we are using the width of the fingers of the person that you are performing acupressure on. So you measure your fingers against theirs. Ours are the same height. Then you take the crease and you put 2 fingers right at the start of the hand. PC6 is located 2 fingers above the crease in between the 2 tendons. This point can be used by someone else performing acupressure or by the person themselves anytime they are feeling nausea. If the person is to perform it on themselves, they would take the other hand and press firmly, remembering to go between the 2 tendons. This point is for nausea in labor or any time during pregnancy, including the first trimester. So as you could see, I did do, with the video, I kind of toggled between lay language and the actual technical language. So what you really want to be doing is catering to the demographic that you're actually going to be teaching to. So if you're teaching to partners or people with no medical knowledge or anatomy knowledge. Okay, so those are kind of then what you want to be doing is really catering your language to them, something that they understand. You'll see the inside ankle bone. Whereas if you're going to be doing a group of nurses or midwives, then you can use the proper anatomy. It really doesn't matter as long as people get a sense of what it's like. And I do find that it is nice in either the one-on-ones during the antenatal visits or in the group styles that you're actually seeing the partner or the doula or the person who's performing the acupressure, you're actually seeing them do it. And that's because it's one thing to watch it. Like, that's a tough thing even about this video is like you can watch it, but you don't really know until you get your hands on someone. So I suggest everyone, you're going to have the recording of this video both at the Maternal Infant Health Canada website as well as through Healthy Seminars. So you can re-watch if you need to get the locations, and then just start practicing ideally on non-pregnant people first so you can get used to it if you're going to be training other people. So here you're going to see an image of the reference sheet that I put up. And basically what you'll see here is that the first page is a point, location, and function. So you'll see, okay, I put spleen 6, and then you have the little image of the spleen 6 and the hand there, so you know it's one hand above. And then I put in bold 37 weeks plus, so it shouldn't be done prior to that. And then I give a description on what that point is, what it does, and the location of it. And this is the one that when you download it, you can actually change the wording to whatever language you need. So that is the location, and then you can see I have all the different points that we have talked about in here. And then at the bottom, the PC6 and the kidney 1 are an anytime acupressure, whereas all the other ones are 37 weeks plus. And then the next page here that you're going to see in your handouts is actually point combinations. So what I've done is I've broken down some of the common reasons people may seek out extra support. So first, in the beginning, you have birth preparation or cervical ripening. I prefer to use the word birth preparation because it's preparing for birth is much more than just the cervix. But you'll see 4 sets of points and then massage. And so you see the image. And then what we do here, and I'm not sure if I can make that larger. I don't think I can. So I'm going to get really close to the screen just so you'll see, like, press firmly for 1 to 2 minutes each point. going in gradually and releasing gradually. And then I've laid out the different, like when you would do it. So at 37 weeks, maybe you would do it once or twice weekly. At 38 weeks, the person can practice 3 to 4 times weekly. 40 plus, they can do it every day. And then up to every 2 hours, if, say, there was a medical induction that was going to be happening or some need for the baby to be born, you could do it more frequently. And then below that, you would see when there is, my goodness, a limit for labor to commence. So that would be the one where if there is a medical intervention that is needed, if there is an induction, or if the waters have, the membranes have broken and there's a time limit to the labor, you'd be able to add in that combination. Increase or regulate contractions. And so there's actually a couple pages of just the different situations that you could use acupressure for. And so the person has like a quick reference to be able to look at that. And so that's actually all of the slides. So as I mentioned, you will have access to the research, the reference sheets, and then even the video if you need to re-look at the point location. I also want to, just before we get into questions, just say that with gratitude, I acknowledge the privilege I have to live, play, and work on the traditional and unceded territories of the Coast Salish people. I want to also really acknowledge Deborah Betts in New Zealand, Kate Levette in Australia, Sarah Budd in the UK, who have worked tirelessly for decades pioneering acupressure and acupuncture for labor globally, and whose work this lecture is based on. And of course, Maternal Infant Health Canada for inviting me to speak, and Healthy Seminars for hosting. So I
was just going to say thank you so much, Emily. This was amazing, and I really appreciate all of the resources you've provided. So I'm sure people will be super keen to check them all out. I was just going to mention I've captured a number of questions that participants have asked in the chat box, so we'll get to those in a quick second. I did want to mention we have some MIHCAN partners joining us from India and from Sudan as well. I'll just give a brief introduction, and before we move on to questions for Emily, I will let our kind of guest speakers give us their thoughts on this awesome presentation. So our first guest speaker is Dr. Pooja Gayagaware, and she's a homeopathic doctor with a degree in public health. She's experienced in mixed methods and health systems evaluation with a focus of on-the-ground challenges of service delivery. So Dr. Pooja, if you're here, we're really keen to hear from you.
Thank you so much. I'm sorry I joined a little late, and it was a really amazing presentation. I enjoyed the videos a lot. It was very informative to get to know what actually you do in acupressure and acupuncture. And it feels that it will be really helpful if it is more widely used, and especially in India, if with huge population and majorly the cost is spent on out of pocket for cesarean section. This will be a really helpful alternative therapy, and if I think there should be more awareness done regarding this alternative thaerappy in India. So I think it is really a good initiative by this by conducting this seminar, and I'm really thankful for conducting this seminar. I have few questions. So I just wanted to know what if there are improper application of acupuncture or acupressure? What hazard can occur in that situation? Secondly, what is the duration of the pressure first? And yeah.
Absolutely. So the first question is a really good question. And so although I do emphasize not starting until 37 weeks, as I mentioned, which you may have come in actually late, the research is very, very favorable for the safety of acupressure. So what's really nice about acupressure is that it doesn't tend to lead to a cascade of intervention, and it tends to show very, very high safety ratings. So even improper use doesn't have there isn't high rates of complications or inappropriate use doesn't tend to lead to a higher morbidity or mortality rates or anything like that. So acupressure is probably one of the safest support tools that can be used. And then your second question, yeah, so depending on what's going on, there are different lengths of time that you would hold the acupressure. Traditionally, before someone's in labor, you would hold it just for a minute or two. So you just kind of hold for a minute and then hang out there. If they are having contractions, you actually want to be holding it for the length of the contraction. So thank you so much for asking that. And I should probably make sure that that's referenced. You want to be, the person who is in labor notices a contraction coming in. As we know, it's kind of like a wave. So in the early stages, when they can feel one's coming on, you would go in really slowly and then hold for the entire contraction. And then when the contraction's done, you would release it again. And then in the reference sheets, I do mention how frequently you can do it. So you may do it before someone who is in labor. You would do it maybe once or twice a week in the early stages when around 37 weeks. You could do it every 2 hours if you were trying to help initiate a labor. So hopefully that answers your question.
I just wanted to ask, are there any diet-related restrictions per se before or during performance of this acupressure point? Or, like, for example, if somebody's pressing the point for nausea or morning sickness, are there any other diet-related preventions or changes one has to do?
Like, is there diet or health changes you have to do when doing acupressure? No. Yes. So acupressure can be done as a standalone. It doesn't have to be done with anything else. However, it is a wonderful adjunct to other tools. So say someone who has nausea, you might be telling them to make sure they're eating every 2 hours, getting them to have foods that don't trigger their nausea, making sure they have a fat or a protein to help regulate their blood sugar levels, and then giving them the extra tools. So I really find acupressure is just one tool for someone to have in their toolbox. It's not the be-all, end-all. However, for people, it can be that one extra piece that really helps them manage whatever they're going through. So it's that one extra piece that can help them cope better so that they don't have to reach out for more medical interventions that have a higher morbidity rate and cost. But it can even be done with an epidural. Like that's the wonderful part of it, is that it's not an either or situation.
So I just wanted to quickly introduce a couple of other members of MIHCAN. So we have Dr. Suad Ismail from the Dean of a Women's College in Sudan with us.
Hello to everybody. Thank you very much to the organizers, and thank you to Emily. It is actually a very interesting session. My background is an obstetrician gynecologist, and I like this very much because it makes labor and childbirth non-medical. It makes it like a natural thing. And and I'm happy about the point you said, that there are researches that it reduces cesarean section, even I think you said 45 or something like this, and it reduces spinal epidural anesthesia and so on. Especially in our countries, this is very, it makes a lot of difference. And nowadays, women, they like to have childbirth a natural thing, not a medical thing. I have one or two questions, and I will go quickly. If there is a severe morning sickness in early pregnancy, is there any place, this is my first question, any place for acupuncture? My other question is that, who is the cadre you are going to train to do this? Are they physiotherapists or midwives? Or because actually it seems like it needs knowledge and it needs anatomy and so on. Thank you very much. I really enjoyed it.
Thank you so much for your feedback and for joining in. It's wonderful to see that there's value around the world and that there's a desire around the world for more tools for supporting birth. So to answer your question, so it sounds like you're talking about maybe hyperemesis gravidarum or some of the more extreme. I will admit that like with this point, it can sometimes help the woman get over that hump of nausea or the wave. However, something like hyperemesis is going to need extra care. It might need, IV fluids. It might need a lot more. In acupuncture, we do have other treatments for it. However, the acupressure, it won't hurt. You can teach her how to do it on herself. So you would show her the point, and then they can actually do it on themselves when they're feeling their waves. But something really extreme may still really need extra intervention in whatever you have. And then the people that you're training is, although it sounds like you need medical knowledge, because there's only a few points and the handouts have images on them, I teach husbands and partners and doulas with absolutely no medical knowledge. And what we do is we just make sure that they're doing it and you're watching them. And because it's very safe, it's actually fine to have this transmission of knowledge directly to the partners or to the doulas. And then often whoever's doing a prenatal class or an antenatal class, they can actually teach the couples themselves. So I teach the couples directly. And most of them, once they've had me show them how to do it, they're fine to do it on their own. And they get the feedback from the woman as well.
Thanks a lot. This is another benefit. Thank you.
No problem.
Hello, Dr. Emily. I'd like to introduce to you Dr. Satya Lakshmi, who is the head of the Naturopathic Institute in India, founded by Mahatma Gandhi.
Hi. Yeah, that was really very nice, Dr. Farashraf and Dr. Emily. And really, we are also happy to share with you. We have just now started one tribal unit in Pune, near Pune. Maybe we can take this, your study and then research methodology and try and understand their practices and catalog the same. And of course, acupressure, we are also training people. Maybe we can take up one program jointly to address more people in India. So that was really wonderful. Very simple, yet very comprehensive, and you made it really simple.
Oh, thank you so much. And I agree. I think that especially that antenatal workshop study that I referenced by Kate Levette, I think that it can be modified very easily, and we could do it in different demographics. So I'm absolutely open to partnership in the future and us creating any way we can to help support people while in childbirth.
Thank you so much, Dr. Satya. Dr. Emily, I have, if it's okay to stay a little bit late, I have several other questions. I'm just going to ask you a few of them in a row, and then if you can maybe just answer them as a cluster. How long does it take for acupressure to induce labor is one. Is it effective in any woman, or is there a selective criteria with more effect in certain groups?
Okay, let's start with those, because I won't be able to gather.
For sure.
So there's no set time limit. As we know, people respond differently to oxytocin. People respond differently to acupressure. So some people, if they're right on the crux, or I say they're like niggling, so they're having like little contractions, but they're not in full labor, they may respond like, I've done a treatment, and oftentimes during the initial acupressure, people just get relaxed and it feels nice. And then it's like they go into a quiet space and suddenly everything kicks in. So you don't have to have, it's not like you press the point and then it's like a button and everything turns on. What you're doing is you're working with a rhythm, and you're slowly kind of increasing the kind of the rhythmic action and the strength of the contractions. So when you're doing someone who, say, they've transitioned from home to the hospital and everything's slowed down, that's a really common time that people will administer acupressure to try and get it up. So that they might notice that if you're just doing with each contraction, there's like a 10-minute, 15-minute, 20-minute gap between. But then as you keep doing it, it starts to pick up and the gaps get smaller. So the key with this is that it's not, this isn't a pharmaceutical that's meant to power and plow through and just force the body. You're working with the body, you're creating a rhythm with the body, and then you often notice that, like, okay, the contractions are getting closer together, they're getting stronger, and you're kind of working that way. And then what was the second question? Or the next one?
Is it effective for any woman, or is there selective criteria which is more effective for certain groups?
No, it's effective for anyone. The key is just what, there are people who are laboring who want no one to come near them, and they want to be in a dark corner and everybody to go away. And so obviously in that person, no matter how great you think acupressure is, it's not appropriate for them. So it really is about, what feels good. And the same thing with the points. For one person, they may be all about having the points here and the ones on the legs that help with establishing contractions. Another person who has, looks on paper like they're having a similar birth, they might be all about the point on the back, and they'll just say, don't take your hands off my back ever. And they will just really emphasize that because that point gives them relief, and that point is the counter pressure that they need. So a lot of it is really just playing it each case individually and what feels good and what seems kind of like the more appropriate points, and then just playing around with it.
Okay. So I'm going to give you a couple of more questions. Should the massage be followed by some fomentation? That's from Dr. Satya Lakshmi, who spoke earlier. And what if a lady has an induction date at 37 or 38 weeks? When should you start the acupressure?
So like I said, the massage can be standalone, or it can be dry hands. It can be with oil. You don't have to It can be with or without, whatever feels comfortable. And then, yes, so when it comes to any sort of form of induction, whether it's acupuncture or acupressure, I always say that if there is a medical need for an induction, so this is not out of the convenience of the obstetrician, it's not because a family member is here, if there's an actual medical need for an induction, 3 days prior. That's my 3 days prior to a medical induction, you can start. So if someone has high blood pressure, preeclampsia, something like that, where the safety requires that the baby be born sooner, then absolutely you can do it. But people get quite lackadaisical about things and start to do it sooner than they should. So I always say no sooner than 3 days prior to a medical induction where it's absolutely necessary for the baby to be born.
Thank you. And so there's 2 more questions. Have you ever had problems with bruising if you use the pressure point over and over? And the last one is, how are you managing all of this in the current COVID climate?
Okay, so bruising occasionally, but like I said, you're matching the pressure that is wanted by the person, but that sometimes in labor is very intense, and the pressure they want to match is very intense. So we have had sometimes where people, especially on the inner ankle, where they might get a little reminder of their acupressure during labor, but as long as you are in the moment matching the pressure that feels comfortable for the person who's laboring, then it's okay. So yeah, occasionally. I've never seen it on the shoulders, I've never seen it in the lower back, but I have seen it once in a while on the inner ankle point. And then, sorry, the last question was the...
how are you managing in COVID?
In COVID times. Well, actually, Sarah Budd, who is online, she mentioned something, and that's that she's doing it via Zoom. So she's working, she's a midwife and an acupuncturist in the UK. And so she was saying she was doing it via Zoom. I have done it via Zoom, and I have taught couples via Zoom. I've also created videos that I send. So anyone who is in 36 weeks onwards, I send them the acupressure links and 2 little videos that I've made to help kind of tell them what to do, and then the handouts that I'm giving you. It's nicer to be in person, especially with like a nervous father who's never done anything like this. It's nice to be in person to be able to show them, but COVID times, you do what you have to do, and via Zoom has been good as well. And sometimes what you can do, I did help a couple who had a stillbirth, or they were laboring a stillbirth, and so we did it live. And because they couldn't have anybody in their room, we just set up the camera in the corner of the room, and then I watched him and I coached him through the points. Because they didn't have anybody else in, and she didn't want to have medical intervention for the birth because they wanted it quiet and to mourn the loss of their baby. So what I did is I would tell them what point, and I'd watch them do it, and then kind of just gauge. And that actually worked really well. And they're pregnant again, and they said, "Can you do it for the next birth as well?" So obviously, even though it was a stillbirth, it was it helped them feel like they were more connected to the birth.
It's amazing how we can be so innovative. Thank you so much, Dr. Solomons, and thank you again to the Dean of Women's College in Sudan, Dr. Swad Babakar Ismail, Dr. Pooja Gaigaware, and Dr. Satya Lakshmi for your comments. Thank you to Healthy Seminars for hosting us, and thank you to all of you for coming. I just want to note we've got friends from Uganda, Dr. Henry Lugobe, Dr. Sampson. We've got people from all over the world, Dr. Sandhya from India, Dr. Hayandavi, so many people, Dr. El Hadi Miskamin from you're in Saudi, right? I think, El Hadi, right now you're in Saudi Arabia. Yeah. So we have people from all over the world joining us, and thank you all of us for joining. And we hope that you are able to join us for other webinars, and please join me in thanking Dr. Solomons for an amazing presentation.